Hello, everyone. Welcome to another episode of the BetterHealthTech Podcast, where we explore how technology, innovation, and leadership are shaping the future of healthcare. Today, I'm really excited to be joined by Virginie Augustin, CEO of Aiding with Care Health Services. Virginie is a healthcare leader focused on home health and behavioral health services, delivering care that prioritizes dignity, safety, and personalized support for patients and families. Her work is centered around something healthcare often struggles with balancing, which is technology and compassion. Virginie, welcome to the show. It's so great to have you here with us today.
Thank you so much, Shelby,
Yes.
for having me. I'm really excited to be here.
Yes.
This topic is very close to my heart because I truly, I believe in the healthcare and I love what I do from home. So I'm very excited to be here.
Yes, we are excited to have you. And before we dive into the future of healthcare, I'd love for the audience to just learn a little bit more about your journey. If you would share about your background and what inspired you to enter healthcare and how was your company created?
Well, how do I say that? Growing up, I grew up with basically my dad, my father, and my mom was always a sick person. And as a child, I always feel helpless when she's when she's going through an episode. So it was always steering me towards the healthcare. And at some point in life, not even at some point, it was always embedded in me to help others. It's something I have a passion for. And my mother is not alive anymore, unfortunately, but it's okay. By having the opportunity to be in the healthcare field, and especially the way I'm steering my companies towards the community to make an impact in my surrounding, I would say it gave me a sense where I could not help my mom. And I still feel it gave me a sense of purpose where I still feel like I can make an impact, even though I couldn't help my mom, but I'm able to help others. And I started the healthcare about 9 years ago. And how do I say that? I won't dare to go back. I'm very happy and content where I am. And started the company. I first started working with person with disability. In our company, we work with kids and we work with seniors too. But I started mainly with the kids on the spectrum. And from there on and throughout time, I developed into acquire bigger licenses where now we provide care to kids and we provide care to seniors. And when I say per care as a home health agency, we send whether it's RN, LPN, CNA, or HHA to the family's home or the school or wherever the patient resides where the service is needed. And in our company, we don't only service senior where, how do we phrase? We serve everyone, basically. Our services are from Medicaid patient to private insurance patient and private pay patients. So we have an open door and we have a motto where everyone matters. So our door is open for everyone and it gives me a sense of purpose. How do I say that? It's more from home to me as an opposed to just a business, if I answer your question. And as the owner, I am Haitian. I'm from Haiti. I came here, I believe I was 12 years old.
Wow.
And yes, I stayed with family. I was in Florida for a little bit and then I moved to New Jersey with my cousin. And then I just said the cold it wasn't sitting too well with me. So I came back to Florida and this is a couple years later.
Well, welcome to Florida. I'm also in Florida, so glad to have you here. And it sounds like, your journey, I'm sure it's even more than what you described. It sounds incredible, and what you do with the compassion and empathy and care just sounds incredible. So, like I said, it's an honor to have you here with us today. And
I'm very happy to be here too. Thank you for having us.
Of course, yes. So, all right, well, let's jump in here. So home healthcare is becoming one of the fastest growing areas in healthcare. I'm sure you know that.
Yes.
With aging populations and hospital capacity challenges, more care is moving from hospitals to homes. So what changes are you seeing in home healthcare today from the past?
I have to say the biggest changes I'm seeing, of course, don't forget AI. But before AI, the biggest changes I'm seeing as before, I would say for the loved ones, especially I started with the kids, it's more, I'm seeing a lot of kids on the spectrum day to day. But another big change is that I'm seeing that is rapidly going where families used to put their loved ones in nursing home and different setting. But what I'm seeing that's happening rapidly is family prefer for their loved ones to be at home. And yes, we go to the hospitals and everything when if the patient needs to be seen by the hospital. But I've been seeing is families want their loved ones to be in a home setting as in opposed to a nursing home setting. I guess it gives them more control and for their loved ones it's more familiarity setting, so it doesn't mentally throw them off guards. Because as seniors, and we often know that as we age, becoming seniors, it's becoming towards a baby. So when you are in an environment where you are used for many, many years, I have a strong belief as you mentally start to decline. I believe it's better to be in a home setting where you live. Basically, some of them have been living in the same home for their whole entire life. So they have a more sense of control whether they know it or not, I would say.
Yes. So your LinkedIn headline says leading with compassion, caring with purpose, which that's such a powerful message. How do you build a culture where caregivers deliver care with empathy every day?
The first, I would say, when I first started, I was wearing many hats. So I used to do this myself from A to Z. It started with whom you hiring and meeting them in person, chatting with them. Yes, they go through an onboarding process, but as a person, what I used to do and what I train my current staff to do is I have to meet you in person and have a few conversations with you. Yes, you have some question to answer to us that we already have ready to go. But at the same time, we communicate with you to see if it's your passion. And we also look at your resume. And if you are new, by talking to you, we could kind of pick up on some trait as a human being. Because as of what we do at Aiding with Care, and not only Aiding with Care, because we do ABA therapy too with our sister company. We hate for a family or a parent to call us and say, hey, this person you sent to us, it's not working out. Then it's more work for us to restaff with another candidate. So the best approach is we normally interview them and we try to have as much humanly conversation as we can with them. And from point on, I can pick up on some traits and we already know if you are a right person to put with the case we currently have open. And every nurse that we have that goes to our families' homes, this is one of the traits they look for: your environment, your type of lifestyle, and then we try our best to match you with the same personality and also with someone with compassion, because you have to understand some of my kiddos, they don't know right from wrong, they don't know danger, and also our seniors, some of them do know, some of them don't know. But at the same time, we make sure that the person that we place in our home is someone we would place in our personal home with our loved one or with our nonverbal children that are on the spectrum.
Yeah, that sounds so important from the beginning of who you're hiring. So as you continue, as your staff continues to grow, what role does leadership play in maintaining that culture? How do you keep that culture in it? What are your thoughts and perspectives there?
I would say our team, we meet on a weekly basis. every Friday or Monday we normally meet, and we use a system called Monday, and we have everything on our board. And on a weekly basis we meet, and I check in with everybody. And even though I go in and out, but I have a manager that's in the office that's been with us for many years, and she knows my trade. She knows what I look for. So when she's screening these candidates when they come in for work, she knows exactly what we're looking for, and she knows it's more trouble for her if she doesn't screen properly, because she will get the phone call that it is not working out. We have to go ahead and restaff. So we keep on a weekly basis. We meet, and I listen to everybody, and they give me a run through what's going on throughout the week. And if something is not sitting well, and we use our system where whatever conversation, whenever we go in a patient chart, we always leave a conversation where we left off. And on a weekly basis, we communicate. And as the owner, and also as a mother, a woman, I have a personal relationship with my staff. So that's how I can keep control. As a human being, I hire staff to work, but at the end of the day, we get to learn each other. So we keep it on a way where we meet on a weekly basis, where I can keep a close relationship with my staff. So I have a more hands-on knowing what's going on in the company per se.
Yes, that's such a strong perspective, and keep humanizing your company. There's, as we are talking about, technology in healthcare, I think it's so important what you said of building personal relationships with your staff. So I commend you on that. And so at BetterHealthTech, we talk about how technology is transforming healthcare delivery. So in your opinion, how is technology changing the way home healthcare is actually delivered?
Oh, I have to say I am amazed. It is a long time coming because something that used to take us, let me jump from home care to ABA therapy. I would say our treatment plan normally take a supervisor or behavior analyst about 6 to 8 hours to complete. And with AI, it's able to take the data you take initially from meeting the patient, because you have to meet the patient in person to do your initial assessment. And from putting it in our CRM system, it actually is giving us a draft of what it should look like. And then from point on, our supervisor goes through it with a fine comb, making sure that everything is as is supposed to be. And then we take it from there. So that right there takes us, basically, I would say technology is giving us more leeway to deal more hands-on with our families, because technology is cutting our admin work into basically from 2 hours to 5 minutes, to, I wouldn't say 5 minutes, because even though it's in minutes, we have to go through it to make sure everything is as is supposed to be. So technology is really making a big difference in the healthcare, because we get to deal more with our families than sitting on a computer and working for hours in a document that is taking many hours, as an opposed AI come in and it's taking a few minutes.
Yeah, that's good to hear. So it sounds like it's improving patient outcomes, which I think that's great. And that should be, standard for, in my opinion, every tech device, software. How do we improve better patient outcomes? So that's really good to hear from your perspective, because you're so hands-on and in the homes,
Yes.
So that is really good to hear.
It really does help, because I would say, I don't see how, but for the service that we provide, we're always going to be human providing the care. But with AI, integrity, how do I say, integrity, merging with what we do, it makes it a more smoothly environment for us to provide the care that is needed.
So in your opinion, what technologies do you believe will be the biggest difference in home healthcare over the next 5 years?
I believe integrated systems will make the biggest impact. Platform that connects caregivers, families, and providers in real time. That's something we're looking forward to. And also predictive tools that help identify risk earlier. whether it's health declining or behavior changes, so we can intervene, sooner to our clients. As it could be the heart rate that is dropping, it could be anything, So this is something that we're looking forward to.
So healthcare globally is facing caregiver shortages and burnout. What are the biggest workforce challenges in home healthcare today, in your opinion?
The biggest one all healthcare providers can relate to is staffing. It is day by day becoming even harder to staff, and it is a strong challenge. Lots of burnout, especially in the behavior side. We've seen a lot of behavior analysts trying to pivot to a different field because they feel like they burning out, and it's just because the way the system is set up. And to go in the home care system is, as you know, there's been a lot of differences in immigration, and as a home care agency, it does make a big impact on us when it comes to staffing. So the approach that we make in our company is we create relationship with schools, many different local schools in our areas. We actually personally go in, and there's some of them we've had relationship for many years. And also we hire staff, actually have about 3 staff that does online onboarding and hiring. And once they have all the document, they have them come in office for orientation. So it's about being creative and using the resources. And it definitely costs, it's pretty costly. It used to be more moderate back then, but especially nowadays, you have to have multiple staff, hiring online and then recruiting in person to be able to cope with the high demand there is in the healthcare system right now.
Yeah. So do you see technology helping reduce any of that burnout? And it could be anything from systems like Monday, but or telehealth systems. But do you see anything that's helping reduce some of the burnout?
Oh, yes, because we have different program available out. Like I am in school currently. We are working on a project where I am building a CRM system that will address a lot of issues that we have as providers. And also because I am inside as a provider, I can tell what are the biggest challenges and what are the little tools that would make a big difference in our life. And it's not only from provider side, it's from the staff side also, make life a little bit easier for them. But AI does, because you have AI answering phone call, and sometimes you don't even know you're talking to an AI,
I know.
Yes, that's how advanced the technology is advancing. So personally, I have not used AI for hiring and onboarding, but I am working on a project that I'm constantly doing interviews and being part of different groups on social media and everything, getting everybody's perspective on, when I say groups, healthcare providers group and also staff group, and getting everybody's perspective so I could put a system together that would make a difference in all of us providers. But it's rapidly growing, and it does help because at some point in the CRM system I'm putting together, there is a bot in there that can actually onboard a staff 100%. The only thing is, I, as a company, and I would recommend once I do launch it as a provider, as a company, it is after AI does everything, which cut everything in, how would I say, something that would take 1 hour and it take 5 minutes. But it is your responsibility to have the staff come in person and vet the staff out, the candidate out, and make sure they are the right fit for your company.
Always the human side.
Yes.
So, yeah.
What we do is the center, like I said, from speaking with me from the very beginning, I don't know if you could hear it in my voice, healthcare, and what healthcare is one thing, but what I do is something I'm very passionate about. And as you mentioned, there's more in depth to it, yes, but I love what I do. because it's home to me. So I train my staff the same way. Anyone you throw in on the floor to work, we need to have a personal relationship with them. And there is something I put in place in the home care, and I've had some staff extremely upset about it. And even the office, we would give them a break also when it's payday. But I don't think it's something I'm going to take away is payday, where I don't offer direct deposit. I want you to come in an office to pick up your check. Why?
Okay.
Because we use a payroll company that I'm extremely happy with, and I can easily switch, and it costs me less money because to point out those check, it costs me money per employee. But it's more so we can interact with the staff. Whether it's you come in and we say, hey, good morning, how's your day going? How is such and such doing? And how's the patient? How's the weekly? How's everything? Because you believe it or not, whether it's vague, whether it's intentionally or they meaning to talk to us, we pick up on something every time they come in office. So I don't think it's something. I've had many conversations, I've had many approach before, and I don't know if I'm going to take it away, but that personal relationship, I want it. Because the staff always pick up on something with our caregivers when they come and pick up their checks.
So commendable. That's a great trait, and I think it's great. Most people don't. A lot of people who I've talked to and who especially have companies are utilizing technology and AI so much that, again, it takes out the human side of it. But,
exactly. Like with our company, I am very involved in the community. Try to be as much as human as I can. At the same time, I love AI. It makes the office's life easier, but at the same time, AI can't do what we do, because at the end of the day, we need human for human, but I love AI at the same time. We learn how to incorporate with each other without any conflict per se.
Great. So in your opinion, what do you believe healthcare will look like in the next decade with, the evolving AI technology? What do you think that looks like in the next decade?
Over time, as fast as technology, I would say with AI, it rapidly developed very fast. But I believe slowly, per se, maybe rapidly, I believe AI is going to get more personalized in the near future, more tech-enabled, where we'll move towards preventative care instead of reactive care. And patient will have more involvement in their own care journey, I believe. I think AI gonna get to that level because it's every day you go online, you see a different app. Every day you go online, you see a different way of a new a person like you and I is thinking of inventing something different with AI. So I believe it will eventually get more personalized, where I think a chatbot at some point could feel our emotion on a personal level. I'm hoping it would take that route. I'm not saying it will ever able to do what we do, maybe at some extent, but I think it will get personalized very close to home as a human being. I think big companies are already working on that.
Exactly. So you lead a healthcare organization that impacts real lives every single day. What advice would you give to a new healthcare entrepreneur or leaders entering this space? What would be one piece of advice?
Personal question. Number one personal advice, and it's not only the healthcare, but going personally to the healthcare. If you do not have the passion to be in the healthcare, you don't have the passion to care for others, I would advise pivot to something else, because in my field, it is very personal and you have to have a caring heart to be in this field. And as a new entrepreneur, and if you do have the passion and to be in the healthcare, I would say as a young entrepreneur is have your goal, have discipline, which is the number one factor to achieve your goal in the healthcare or any career per se. I would say be disciplined and motivated and take your job seriously, what you do seriously, and make an impact in everyday life,
That's great. That's good advice. All right. So we're going to move on to our last segment, which is called the rapid fire questions. This is just fun and short, easy questions. They could be one-word answers, just a quick response of whatever comes to your mind when I ask you these next set of questions. And if you don't have an answer, just say pass. But all right, let's do it. So what's one technology to work? I think I might know the answer to this first one, but what is one technology you wish already existed in healthcare today?
I would say a fully integrated system that connects all providers and caregivers and also family in real time.
Okay, great. And I can only guess that might be what you might be working on. Yes, which sounds amazing. We'll have to have you back. And then the next question is, what is one daily habit that keeps you productive as a healthcare leader?
I have my expectation for my days.
Your routine.
Yes, my routine. Yes, I couldn't find the word.
That's great. Routine is important. All right. So the next one is, what's one thing in healthcare that urgently needs to be fixed?
I would say access to quality care and workforce shortage. That's a big thing. All of us, whether it's hospital, any healthcare, that's one thing we are having trouble with, especially at my side. It's staffing. It's the shortages for staff is incredibly insane per se, to be extreme.
Interesting. All right. What is one healthcare innovation you're most excited about right now?
I would say AI in remote monitoring.
Okay. And one leadership trait every healthcare professional should develop?
Empathy.
If you could change one policy in healthcare tomorrow, what would it be?
I would say, honestly, working with Medicaid patient, I would say better support and funding for home care and behavior therapy services on the Medicaid side, because we have some of our patients that are needing more help than others, and the price we paying them, I as a provider, I look at it, it's not doable, but we do find good staff to provide a care. But it's one thing if our government could revisit the fee schedule for the Medicaid patients. I believe it would make a big impact on those patients' life from a provider standpoint, because we are in the life of the families by the hour, by the minute, and by the day. That's what we all are seeing.
Yeah, that's good. Well, I appreciate you so much for being here today. Thank you for sharing all of your insights and your experience with us. Healthcare really needs leaders who understand both the human care and innovation. And your work in home and behavioral healthcare clearly reflects that balance. It really does.
Yes. And thank you so much for having me. This was a very great conversation. So it's thank you for having me.
Yes, and we'll have to have you back when you further develop your system. I can't wait to hear about it. So
yes. I would love the opportunity to share further perspective, and I look forward to seeing how healthcare continue to evolve.
It's so important. And to our listeners, if you enjoyed this conversation, make sure you follow the BetterHealthTech Podcast for more discussions with healthcare leaders shaping the future of care. Thank you for joining us, and we'll see you in the next episode.
Thank you.